Good morning, everybody. Thank you for coming. This is a very exciting day for us today. It's really represents a step forward in a couple different respects. It's a first of its kind partnership in the entire state. MetroHealth and Cuyahoga County have teamed up to provide a HealthSpot station, which is located behind me, for county employees. We're the first public entity in the entire state to provide this kind of service for our employees who use Metro. And it helps us do a couple of things, and we're going to hear from medical professionals that are going to talk about this more in detail, but it's helping us achieve a couple of our goals. First of all, it's expanding access for our county employees to high quality, low cost healthcare assistance. Secondly, it's another step in our process of integrating a comprehensive wellness strategy, which we started actually a couple years ago, and which we've actually incentivized with our insurance programs, and which has been to date very successful, both in saving the county millions of dollars and also making our employees healthier. Those things aren't contradictory, they're complementary. And lastly, and I want to just compliment so much the energy and spirit that Dr. Boutros has brought to the Metro system, working with a great team that was already here, but it's just strengthening the partnership that has always existed between Metro and Cuyahoga County government. I'm not going to go too much into detail with the specifics of the way it works, but I could just say that this is what you have behind me is it's a medical kiosk. It's walk-in. It's really ideal for employees that are having minor complaints. If there's something more serious, they'll be referred elsewhere. It gives them an opportunity in a very cutting-edge way to interact with excellent providers from the MetroHealth system. It uses basically a video conferencing model, and it gives them biomedical information in real time. The MetroHealth providers are able to make a preliminary diagnosis right on the spot, and then again, if there's need for follow-up, they can do that. It is not going to cost an employee that is already using the MetroHealth insurance plan. This is going to be free of charge, and that's so important when you talk about preventable care. We want to do everything possible to switch from a system where an employee or a citizen of Cuyahoga County feels like they have to be in dire circumstances before they seek medical treatment. That's exactly what we don't want to happen. We want it to be convenient, we want it to be low cost, we want it to be regular, and we want that employee and that individual to feel like they have access to expert medical care as soon as they feel like they need it. So at this point in time, I want to turn it over to some of the medical professionals that are helping make this a reality, and I'm going to begin with the new CEO of MetroHealth, Dr. Akram Boutros. Doctor?
Thank you very much. So we're very delighted to have this partnership with the county. This is a really terrific collaboration between Cuyahoga County and MetroHealth. The partnership is going to bring convenient health care on-site to county workers with a valid Cuyahoga County badge. So how does this collaboration come together? Well, it unites county employees and MetroHealth doctors through a virtual appointment. This is a two-way communication, high-definition video conferencing that's in a fully enclosed private kiosk. Today, this kiosk contains some rudimentary testing and examination tools, but we can see that really expanding very quickly to add such things as EKGs, to add vision testing, to add so many different things. And what it will do is help the patient have an intervention early on and not require an emergency room visit or a doctor's visit. They can have it done right away. One of the best things is that the information gathered here is going to be incorporated into their electronic medical record. And that electronic medical record is going to be available to all their physicians and to the patient themselves anytime they need it. It's free to county workers, and it fits in really well with our new mission of leading the way to a healthier community. It also further our value of the quest for excellence, bringing innovative care to county workers. So the HealthSpot will be open on Monday through Fridays, noon to 4:30. It will be manned with our one of our medical assistants who is very familiar with the employees here in the Justice Center, and I think it's going to be, what we're going to see is utilization of that HealthSpot create not only value for the employees themselves, create value for the Cuyahoga County, and really have preventable admissions for all of us. So we're delighted to be a part of this. Thank you very much.
Great. Thank you, Doctor. Thank you for not being distracted by the horrible screeching noise behind you. That wasn't a symptom of anything. That was really happening. I want to turn it over at this point to Robbie Page. He's the Vice President of Business Development for HealthSpot. Before he starts, I just want to say the other thing I like about this program is it's an example of using medical technology. In just a few days, actually, we'll be opening the Global Center for Health Innovation right across the street from here. So this is also, I think, great symbolism that Cuyahoga County government is embracing technology. We're increasingly trying to brand Greater Cleveland as a place not just to receive medical care, but also a place for medical innovation. And this program, that we're using on a pilot basis, I think is one of the futures of healthcare. And somebody that can speak to that more directly is Robbie Page, Vice President of Business Development for HealthSpot. Go right ahead.
Thank you. Thank you. So, on behalf of HealthSpot, I'd like to thank Cuyahoga County and MetroHealth for having us here today and for partnering with us on the reinvention of healthcare. There are so many challenges that face healthcare today. We've always believed that access to a doctor should not be one of them. How many times have you had to take a half day or more off from work because you've woken up not feeling well with a sore throat or a cough? How often have you had to use your personal time or sick time for a simple follow-up appointment? This is why we've worked so hard to bring the HealthSpot station to market. Now county employees can get in, get seen, and get on their way. Through high-definition video conferencing and integrated medical devices, the tremendous providers from MetroHealth can continue to provide the high-quality care they're known for. Excuse me. We are extremely excited that Cuyahoga County and MetroHealth both have the vision and the commitment necessary to meet the challenges that face us in healthcare today and to leverage technology such as the HealthSpot station. Thank you all.
Great. Metro is such a great institution. There's so many great people that work there. One of the great things about Metro is they are true to their original mission, but they are also innovating, and they've embraced change at the same time. We're also going to hear from Julia Bruner, Dr. Julia Bruner. She's the medical director for Metro Express Care from MetroHealth, to say a few words about this. Doctor?
Hi, good afternoon or good morning. I think we're still at 10 o'clock, I think. I'd like to say thank you to the county for allowing us to have the opportunity to pilot this project with their employees. On our end, we've done a lot of work as a team to make sure that this process was fairly seamless, and the providers are very excited to be able to provide this care through the HealthSpot technology. In a moment, you're going to be seeing a little run through as to how this process will work for a patient, and I think you'll be quite surprised as to how interactive we can be through this technology. So thank you very much.
Great. I don't think we have any other speakers, do we? No. I do want to recognize our HR team. Our HR director, Elise Hara, is here only because, there she is, only because I don't think we would have ever gotten to this place with Metro if we hadn't very early on put this focus on how we were going to try to promote wellness and preventative care with our employees. We are arguably, first of all, I know we're doing it more than any other public entity. I think we're coming close to doing as much as any private entity, and that would not have happened without her leadership. So thank you for that, Elise. I want to thank you for coming. I think they're going to do a little bit of a demonstration, and if there's questions, you can come up to us afterwards. Thank you very much for coming. Appreciate it.